All right, it's rolling.
Hey, what's up everyone? Dr. Dan Graham coming right back at you from downtown Gilbert Healthcare, and we got the resident expert on health, Dr. Alan Bradford.
That's high regard. I don't know if I would say that, but yeah, thanks.
All right, Doc, so we are going to be talking about people that are tired and wired.
Yeah.
Now, to me, when you throw that at us, then that doesn't necessarily, those two words don't jive. So, what does that actually mean?
Sure. So, stress is something that a lot of people talk about when they come into the office with me, and stress is kind of, it's kind of a all-encompassing term, right? We don't really know how to define that. So, I want to talk about something that can be really helpful to pinpoint what's going on with my patients that are exhausted at the end of the day. They want to go to bed, but they can't shut off the brain, right?
Oh.
They're just, that hamster is in that wheel and he's moving and he's preventing you from falling asleep. Also people that are crashing in the middle of the day, you need to go grab that 5-hour energy at 2, 3 o'clock. And people that just can't sustain good, healthy energy throughout the day.
So, as I add into this, a body that is in really good shape, really healthy, we should be waking up, ready to go, have energy throughout the day, and then when it comes time to settle down, we settle down, fall right to sleep, get a good 8 hours of sleep at the very least, and replenish our body, get ready to go again. But so often, with the way everything is going these days, from you get people freaking out about COVID, you have people working long hours, working from home, can't get out of the home. Now they're with their spouses, 24/7. I hear that all the time. Girls walking in, I'm like, what's your stress? I'm like, they're like, well, I can't get away. So this is my break. So when we have all of these stressors from pain that aggravates our musculoskeletal system, emotional stress, mental stress, all of these things can add up, and they can be even deadly. There's a syndrome that when someone gets so ramped up with stress that they can have a heart attack.
Yeah.
Also, one thing that I've seen is that in people that have been in auto accidents, sometimes we will see changes in the genetic structure to where we go from a genotype to a phenotype, where some people will come down with all of a sudden autoimmune disease where the accident didn't cause it. It was just lying in wait, so that stress would actually...
The needle that kind of broke the camel's back.
Right.
That
so
is.
this is very, very important to talk about. So when we have someone who is under a lot of stress and they can't think straight, their memory is poor, they're wired and tired, they can't keep focused. They're starting to go to the doctor to say, hey, maybe I have ADHD or something like that.
Yeah.
From a naturopathic perspective, what do we do?
So, like I've said in other videos where we've been chatting, with better information, we make better decisions. So one area that we can check is something called cortisol. Specifically something called cortisol awakening response.
Okay.
So cortisol, it's a hormone, it's made in our adrenal glands. Cortisol is often referred to as our stress hormone. It's produced in higher amounts in times of stress, times of injury, times of trauma. So cortisol, throughout a 24-hour period, should follow a certain rhythm. It should spike in the morning when we wake up. That's what gives us our get up and go, ready to go, without having a coffee, without having an energy drink. Should spike in the morning within a couple hours, and then slowly taper off throughout the day and be at its lowest point at the evening, in the evening time when melatonin kicks in and takes over and helps us get into sleep.
Okay.
So with this particular test, so this is the same company that does our other hormone testing. They offer a specific test called the cortisol awakening response, and it's kind of unique. It's a saliva test. So this is a little sample. You're not spitting in a cup. You're not carrying around a little jar where you have to fill it up with spit. You put these little, it's kind of like a dense foam thing. You stick this in your mouth. It absorbs the saliva. You stick it back in the test tube. Stick it in the freezer until you're ready to send all the samples home. And this is a super accurate way to collect saliva and to measure cortisol. This is actually the method that researchers use when they're measuring cortisol.
The gold standard.
Yeah.
So when, say if someone, is really healthy, they have the normal cortisol pattern, in someone who's stressed out, what do we typically see?
So, like I said, normal rhythm is spike in the morning, taper off throughout the day. Things that I've seen with patients that I've tested, some people are flatlined, like they're never even making hardly any cortisol. Some people, that rhythm is completely flipped. It's tanking in the morning, it never gives you that get up and go, and then in the bedtime, it rises. And those are my wired and tired patients. They're exhausted mentally, they're exhausted physically, but they just can't stop that from moving, and it really can interfere with sleep. When we sleep, we recover and heal, so it can interfere with, being able to lose weight effectively, being able to have that sustained energy the next morning. So, yeah.
So, and just to get this across, a normal blood test will not catch this type of response.
So we can test cortisol with a blood test. The best you're going to do with a blood test is a morning cortisol level and a PM cortisol level, they call it on the lab, which, you're not going to have a lab that's open at 10 o'clock at night, right? So the latest in the day, usually, that you're going to check a PM cortisol is like 4 or 5 o'clock in the evening, which, in my opinion, is not, it's not helpful.
So you get kind of the test results over 2 versus this one was 5.
Yeah, 5 samples throughout the day. An extra sample that we can do if somebody's waking up in the middle of the night, to check for insomnia, to see if cortisol is interfering with your sleep pattern through the night. But yeah, it's a kit that you take home, so it's super easy to collect. You don't have to draw blood, you don't have to go into a lab, and we get way better information. So
now, I've had some patients that have gone through this, and it's one thing to say, okay, we got, your cortisol's flipped, you're in rough shape, but what do we do about it? And what's fascinating, I'll have you explain a little bit about the treatment, but the patients that I've seen are, it's fascinating. It's almost like they are on an energy drink without being on an energy drink, because once they get that homeostasis where the cortisol is in check, then all of a sudden that normal pattern where they wake up, they don't feel like they have to go through, a pot of coffee to get going. They don't have the crash that starts about noontime, and then they're reaching for an energy drink, and then wondering why they're still falling asleep at 7 o'clock. So
sometimes I get my patients mad at me because what starts to happen is people are waking up before their alarm clock goes off, and like ready to go. For some reason that pisses them off. But yeah, we see that. So what's the treatment? So using herbal supplements, vitamins, certain targeted nutrients to help bring that cortisol balance back into balance. Also focusing on food and what time of day do you eat, that can affect your sleep at night and stress. And honestly, cutting back on some of these stimulant things that can throw off cortisol. Caffeine, to be honest, is not great for the adrenal glands. So if we can pull back on things that are maybe a little more damaging in the long run and give the body what it needs, your body knows what to do. It's smart.
Yeah.
So.
Well, I want to invite everyone to make an appointment with Dr. Bradford and have this checked. This is one part of the many things that he offers in order to help people throughout their life. It reminds me of the one patient where she came in and she was like down in the dumps, no energy. She was overweight, and then all of a sudden, it's like as you did the hormone testing, the cortisol testing, she came in with her husband, and she goes, Dr. Dan, you need to make me an appointment with Dr. Bradford for my husband because he's not keeping up with me. And so anyway, and I was fascinated to see how good she felt. She said, and she's in her 50s, but she says, I cannot believe how good I feel, the energy that I have, the clear thinking that I have. And so we got her husband involved in this process. They are both dropping weight like you would not believe. But what's fascinating too is that in her work, because of the increased energy and being able to handle the workload. She's actually had her last 2 best months at work for sales, which is fascinating and a great, great thing.
Yeah.
So Doc, we want to thank you. Thank you for that great information.
You bet.
All right.